welcome Dr. Arline T. Geronimus, Professor, Health Behavior and Health Equity at University of Michigan, and member of the National Academy of Medicine.
Good morning. Okay. At age 50, Jason Hargrove was a proud and reliable Detroit bus driver and a married father of 6. In early 2020, Mr. Hargrove's Facebook profile picture showed him on his bus wearing a face mask with the Detroit Public Transportation logo clearly visible on his hat. He wrote on the hashtags that surrounded his photo read @coronavirus, @I cannot stay home, @I'm on the road for you. Mr. Hargrove posted a video on March 21st, 2020, which he stepped off his bus to record, evidently in need of fresh air and cooling off as we see him wiping sweat from his brow on this Michigan winter's day. He shares his fear and righteous consternation at the fact that a passenger on his bus coughed repeatedly without covering her mouth. He makes an effort to prevent those watching from writing him off as an angry black man by emphasizing his years of service and sacrifice. "There's folks dying of this," he says into the camera, "and I am trying to be the professional they want me to be." He assures his wife that when he comes home, he will take off his tainted uniform and put it in the wash and himself in the shower before uniting with his family. 4 days after making this video, Mr. Hargrove was diagnosed with COVID-19. Although he sought medical care, he was not admitted to the hospital. A week later, on April 1st, he died from complications of the disease. In March 2020, we were beginning to identify risk factors to inform triage as sick people overwhelmed hospital capacity. The clearest risk factor for death was being elderly. At 50, Mr. Hargrove didn't qualify. Indeed, on average, only 3 out of 100,000 50-year-old Americans diagnosed with COVID died of the infection. For Mr. Hargrove, as well as for many others in the Black and other marginalized communities, his underlying cause of death dates back centuries. Beginning long before COVID and echoing the tenacious civil rights activist Fannie Lou Hamer, young through middle-aged adults of color speak of being sick and tired, and they are right physiologically as well as existentially. The chronic activation of measurable physiological stress processes in their bodies over years and decades shortens their healthy life expectancy and hastens their death. I coined the term weathering to name the structurally rooted physiological process of accelerated wear and tear throughout the body. Weathering is a measurable biopsychosocial process that leaves identifiable groups of Americans vulnerable to dying or suffering chronic disease and disability long before they are chronologically old. Through weathering, members of marginalized populations age prematurely, no matter how well they follow the social contract, the American creed, or the latest dispatches from the front lines of healthy behavioral science. As human beings, the inner workings of our bodies are always active and adapting, physiologically responding to environmental stimuli to keep us safe, whether from a raging beast, an objective environmental challenge such as sub-zero temperatures, or a threat to our social identity safety such as a racist aggression. Our neuroendocrinological wiring is exquisitely attuned to being alert for such danger, both consciously and unconsciously. Research in social psychology tells us that members of marginalized social identity groups enter new situations with uncertainty and become vigilant for cues indicating whether or not they belong, can trust others, may be in physical danger, can be authentic, or will be treated fairly. Such vigilance automatically activates the human physiological stress response, flooding our blood systems with stress hormones that mobilize sugars, fatty and amino acids out of storage sites for energy, and immune cells in anticipation of wounds. If we are able to evade the immediate danger or are reassured that it was a false alarm, the flood of stress hormones recedes and our body returns to baseline functioning in short order. This automatic process is protective when we are in an acute life or death situation and is also adaptive for other kinds of threats that are short-lived. However, our stress process stays activated when the stressors that trigger it appear repeatedly in our daily round, are prolonged, or remain unresolved. Randomized controlled trials consistently find that these types of biopsychosocial stressors can result in hours, even days, weeks, or months-long physiological arousal and reactivity sustained even while you sleep. In this predicament, over years and decades, any human being would experience cumulative stress-mediated wear and tear across their cardiovascular, metabolic, neuroendocrine, and immune systems. Those systems then become damaged, dysregulated, weakened, and eventually exhausted. Through this automatic and chronic process, populations subject to weathering pay a scientifically demonstrated health tax in the early onset of chronic disease, in unconscionably high rates of maternal and infant mortality, in depression and anxiety, in autoimmune diseases like lupus, in infectious disease, and in cancers. At the molecular level, cell aging, death or senescence accelerates. Based on his likelihood of being weathered, Jason Hargrove's biological age at 50 would look more like an affluent white American's biological age at 70. Indeed, in those early days of the pandemic, 50-year-old Black Americans died from COVID-19 at the same rate as 70-year-old white Americans. Now, of course, everyone experiences stress sometimes, and even stress and coping that is prolonged. But how likely or deeply these experiences weather your body depends on your social position and opportunities for recovery, including the balance of time spent in settings where you can relax and release, instead of in places where you automatically remain vigilant and extend yourself beyond your physical or emotional limits to increase your chances of safety or success. In the current historical moment, there are reasons to expect weathering to expand to new groups and intensify in historical targets. For many Americans, our everyday world is objectively becoming more uncertain and threatening. Protections are being diminished, and opportunities for expressing ourselves freely are put on ice. From Latino immigrants to seasoned Black professionals to talk show hosts to school children, more and more of us need to keep our heads on a swivel to protect our lives and livelihoods, gain respect, or attempt to live unapologetically. As roving patrols of ICE agents now have license to show up unannounced and make arrests based on profiling, childhood vaccine mandates have been eviscerated, cancer and mRNA research defunded, jobs lost, housing unaffordable, and as climate change disasters loom, people's anxieties are multiple and sustained. Weathering adds to and interacts with socioeconomic, environmental, and lifestyle determinants of health to exert its pressure on morbidity and mortality. Weathering most deeply afflicts responsible, tenacious, hopeful, and loving members of the working or middle class, like the late Jason Hargrove. Short of action, weathering will remain the destiny of the marginalized, but it doesn't have to. When confronted with such clear inequity, we have to see what we can do about it. In addition to the other levers being recommended today, approaches to advance health equity must also address weathering, or they will fall short of their goals. Thank you.